Next on episode 19 of the Bill Gephardt Show, a tale of two mayors and the politics of the pandemic. Why they say a bill passed by the legislature and signed by the governor could end up costing Utah lives.
We've been taking a data-based approach this entire time in Salt Lake City. That's my job as the mayor, is to try to protect the health of our residents, of our visitors. We're just not there yet. We're getting there, and we're going to get there soon. There's light at the end of the tunnel. We can all feel it. But come on, let's not spike this football before we get to the end zone.
I was cut out of the conversation, probably somewhat deliberately, because I have been making tough decisions since the first mask mandate, and certain legislators, mainly not in my county, don't like that.
Our podcast today brought to you by these fine sponsors of local journalism. Robert J. DeBry and Associates. When you're injured, your attorney matters. All Utah Plumbing, Heating, and Air, where John Holland and his team stand behind their white glove service with some of the best guarantees in the business. And by ES Solar, save with solar powered today, the clean, safe energy of the future. Plus, special guest sponsor, Legacy RV Center. Let's welcome to the podcast now the mayor of Salt Lake County, the Democrat Jenny Wilson. Welcome.
Thanks for having me.
It was about 10 months ago that you put the mask mandate on all of the county, and I didn't know where we'd be 10 months later, which takes us to today. But I'm a confused guy because I have leaders like you, and I have leaders in the governor's office, and I have leaders in city governments, and we're all telling us different things about whether to wear a mask, sometimes whether or not to get a vaccination. But mostly I want to stick with masks. The state has, the governor has signed a bill that on Saturday, the 10th, we no longer have to wear masks in the state. And over in Salt Lake City, Mayor Mendenhall said, no, we're going to still wear a mask.
But basically, the legislature created a checkerboard effect in our state regarding masks by passing this bill. And what they allowed was local councils or the commissioners to determine, along with the health departments, whether or not masks would continue in their respective counties. The health department chose not to extend, and the council went along with it. So with that, our various cities and townships in Salt Lake County, masks are not required. However, businesses can require. And in Mayor Mendenhall's case, she felt comfortable with the engagement of her legal team at the city to impose for the city. Representative Ray said that's not okay. You can't do that. She said, yes, I can, and I'm going to. So if you are in Salt Lake City, business as usual, as it has been under the state mask mandate. If you're in Mill Creek, unless Mayor Silvestrini's going to do what she did, you won't have to wear a mask unless a business, or in my case, our county facilities, say you need to.
I heard someone say this is kind of like having a peeing section in the pool. It really affects everybody, right?
In reality, elected officials have a very, very different lens on this emergency. I can tell you, I would challenge any elected official in the state to tell me they put more time into this crisis than I have. It literally has dominated the year for me, the year plus. I'm doing other things and I've got great staff, but I'll tell you, those early days, 90% of my time was interpreting data, working with the health department. And I think I'm a little put off by, legislators who don't live in my county making this call. I think if you ask the legislators in my county and really educated them on this bill, they would agree with me that we need more time. So, I'll play the deck of cards that I'm given, and I have some still working on vaccine administration, focusing in areas where we don't see as high rates. What the card I don't have to play right now is enough vaccine. Yeah. Only 1/3 of our residents now have full immunity, which is why I think a mask makes sense. The other issue is my son can't get vaccinated. Your kids, grandkids, if they're under the age of 18, cannot get vaccinated, or 16 rather, can't get vaccinated. We have workers who are older who want to get vaccinated but can't get appointments right now because the flow of vaccine isn't high enough. So until we get everybody who wants to be vaccinated, and then we reassess where we need to be with our kids, we should wear masks.
I flew out of town last week, and the flight attendant, while giving the safety briefing, said, I didn't wake up this morning to argue with you about whether or not a mask mandate is a good thing or a bad thing. Just wear your mask. It's the federal rule. So it took it off the airline, just like it takes it off. You took it off, the burden of the businesses.
I think this is very anti-business. We've heard Tony Caputo share publicly recently that he's had intimidation of his employees. I don't know if his employees can get in to get a vaccine right now because we don't have enough and our appointments are gone until May. So it really is anti-business to see this battle. And, right now, the thing I can tell you is grab your mask, get in your car, drive to Southern Utah, enjoy, we can breathe again. Just wear your mask when you're out. It's not that big a deal. If everybody in your car is vaccinated, take your mask off. This is not a big deal anymore. We're making it a big deal again. It's beyond me.
That's a good way of putting it. We're making it a big deal again. And we should just be wearing masks until we get to, herd immunity, or the number of percentage of people that need to be vaccinated so we don't have to spread, or get enough vaccine for everybody who's under 18 or under 16. Let me ask you this. What about the decision? You talked about this earlier by the health department to go along with ending the mandate. Were you surprised by that? Because frankly, I was.
I think we have a very strong health department director, Gary Edwards. I think he was looking at it a little more narrow lens than I was. And I don't know what his conversations were with the council. Again, I was cut out of the conversation, probably somewhat deliberately, because I have been making tough decisions since the first mask mandate, and certain legislators, mainly not in my county, don't like that. So, the county council have been engaged, but not, again, living this all day, every day, to the wee hours of the night. And I think that I think there was a miss, but Gary's a great health department director. And I suppose I can, if I look at it from a more narrow lane, I can say, our cases are down. We're not overrunning our health department, our health system. Our emergency beds are under control, which is great. Yeah. But go talk to a nurse who's still caring for COVID patients. The game hasn't changed if you get it.
No, it hasn't.
The game has not changed.
No, and the fact that cases are down, this has happened before and before and before across the country, and even in Utah, where, remember, it only took 1 or 2 cases to enter the United States to spread this thing to more than 500,000 people dead. So the fact that it's down, if you're not vaccinated and you are exposed to someone and you are vulnerable, you could get dead or very sick or have long-term illness as well. That's my worry. And I get this conflicting information from the various politicians in our state. It's frustrating.
You're going to get a mixed bag in any state right now, unfortunately. This was politicized long ago. And it's the world we're living in. And I think the one consistent thing I heard from Gary Edwards, our county council, who would not impose a mask mandate or kind of push him on it, our governor, I don't know about legislators, some will, some won't, but the vast majority of your elected officials are saying wear a mask for now, whether it's mandated or personal choice. So that's the smart thing to do. I worry about kids, and I'm looking and watching the trials to see when we're going to be able
to. The kids and minorities are being thrown under the bus for a few political points, frankly.
Yeah. And you know what? It's funny. In the early days, my father said to me, I think the elderly are being thrown under the bus. Well, luckily we were able to vaccinate them, and they're better. Anybody elderly certainly can get vaccinated. Yes. But
Ted Wilson, so we know, for those of us who've forgotten. Ted Wilson.
Yeah, my dad's a former mayor, and he's vaccinated now. And I think, he would probably say, if I asked him, it's the kids now being thrown under the bus because and I worry about that. If there is a situation where you go into a grocery store, they aren't requiring masks, You're taking your young child in there, and there are a bunch of people without masks. As a mom, I'd be like, "Are you vaccinated?"
Yeah, I know.
It just creates that question, and it does. Any one life lost needlessly is one too many.
Yeah.
We're going to continue with the mask mandate or not, unfortunately, to lose people until we get this behind us, until we get to herd immunity and beyond. And we know it even better. And we know if we all need a booster. But I would say, we can minimize lives lost by using the best tool we have, and that's a mask. It just is. There's no argument about that anymore.
And you cannot mandate a mask anymore. Apparently, I'm getting back to that. There's some controversy about that. You cannot continue a mask mandate where
I cannot. The legislature, and it's complicated, but the legislature that was passed and the governor signed into law cut county elected or executives out. Was that deliberate or was that just in drafting? Commissioners are both legislators and executives.
Okay.
So commissioners with their health departments get to make the call. Those of us who have chosen a mayor council form, what the legislature did was specifically empower the county council, not the mayor. I mean, I've got a great county council, but they have not been overseeing of the health department, working day in and day out on this, knowing they have a different role, but that's who the legislature decided to put in charge.
And yet the mayors of cities can still do the mandate thing?
My understanding is the legislation was silent on municipalities. So anytime the legislature writes a bill about anything, they might say cities of the first class, which means or counties of the first class, cities of the first class. There's a certain code for how you regulate and how you empower. And they did not list any specific language for municipalities.
Okay.
So the mayor's attorney interpreted that she had the latitude to do so. And I support her. She busted a move. I live in Salt Lake City, so I feel safer in Salt Lake City, frankly.
You're not giving up the fight. What's next?
Well, we, on a literally daily basis, our team's checking in with the federal government to plan ahead. We want to know how many appointments we can open up for May. We're told a lot more. So if any adult is out there, anybody over 16, I guess 16 to 18 is not an adult, but they're eligible for Pfizer. So we're going to hold Pfizer for kids, generally 16 to 18.
Great.
We are working with the schools right now to get it out. And we are hoping that all adults will come back to our website or call in last week of April and get signed up for those May appointments.
All right, Jenny Wilson, the mayor of Salt Lake County, who, if I had to guess, is even more frustrated than I am, right?
It doesn't make sense. Why do we need a checkerboard right now when we could be, reasonable here and avoid this conflict?
Mayor Jenny Wilson, thank you for joining us.
Thanks, Bill.
Okay, let's invite another politician to the podcast now. It's Erin Mendenhall. She's the mayor of Salt Lake City, and good day to you.
I prefer public servant, but thanks for having me on.
The state passed a law that said that on Saturday, we don't have to wear masks anymore. And you said, no, that's not what's going to happen in Salt Lake City. And meantime, the county says, yes, in county buildings, but not out in public. And I am so confused. Can you help me?
I think the place where you can be the least confused is right here in Salt Lake City, because nothing's going to change. It's the same way that the state mandate and the county mandate have been directing our usage of masks for the last many, many months.
Yes.
And we're the only place so far that's going to stay put.
Your vaccine, of course, right?
I'm half vaxxed right now.
Okay. Well, let me tell you how silly the vaccination program is. Not that vaccinations are silly, but if you go to the county website, the health department website, and it's frequently asked questions, and about 8 down there, it says, the question asked, the common question is, do the vaccines contain a chip, a tracking chip? And then they say no. But I can't believe we've gotten to this point on this whole pandemic that, we're wearing masks. And I told Mayor Wilson over at the county, I said, I was on that airplane last weekend, and one of the flight attendants who was giving the safety pitch said, listen, I didn't wake up this morning to argue with you about whether or not masks are any good. Just wear it. It's the federal rule. But it's hard to figure out for the average person who to believe.
When it comes to masks, it's not rocket science, and it's not news either that they work, which is why we keep talking about it, Bill. Masks are the easiest thing we can do to keep our economy wide open and keep our kids being able to go to school. And I just think there's a little bit of an irony to me about this narrative that there are things in the vaccines that are not actually in there when we carry these things around with
Yes.
chips in our pockets
Yes.
more than ever before in the human experience. So get your vaccines, get this thing done so we can get back to the economy and engagement as social creatures.
So here we're down to fewer cases in Utah. And you, for one, do not want to lift the restrictions. We want to get it down closer to zero.
Well, the state legislature they've set this date through one bill talking about April 10th, no more masks. And it's not connected in any way to the data-based approach that we collectively have been trying to follow. The state also set these 3 thresholds that are looking at case rates, which we've already succeeded at achieving, COVID ICU utilization, which is down now below the threshold they set. And the last one that's remaining are these prime doses of the vaccine entering the state, not actually entering anybody's arm, but just being received by the state. They set that number at about 1.6 million doses. We're not even 60% of the way there yet on that third and final dose allocation parameter. We could debate all day whether or not 1.6333 million is the right number of doses to be received by the state for us to say, okay, the emergency is over. But that is what the legislature said. And we've been taking a data-based approach this entire time as Salt Lake City. That's my job as the mayor, is to try to protect the health of our residents, of our visitors, and of the businesses that employ our people. And as we look at the data, this is why the chamber supports this decision. We see the University of Utah showing up to support our decision. We're just not there yet. We're getting there, and we're going to get there soon. There's light at the end of the tunnel. We can all feel it. But come on, let's not spike this football before we get to the end zone.
You get along with Spencer Cox, our lieutenant governor, right?
Yeah.
Have you talked to him about why he signed this thing?
Yeah, you should have him on the show.
Yeah, well, we have, and we will again. That's right.
I don't think that he was very enthusiastic about this, but it was a negotiation, and he ended up getting us a later date. April 10th is later than I think what the legislature was pushing for in the first place.
Yeah, it's because, and still we have to wear masks in state buildings, even though we're not requiring it in other buildings. And there's somebody who said, if you just require it, and I said this, earlier to Jenny Wilson, if you require only one little group over here, to have to wear masks, it's like having a designated spot in the swimming pool for peeing, right? It really doesn't do any good. Who said that? I can't remember who said that.
We know that there's
I know who it was. It was a science guy. What was his name, Patrick?
A science guy, Bill Nye.
Yeah.
DeGrasse.
No. Who was it?
DeGrasse.
Oh yeah, Neil
deGrasse
Tyson. That's who said it. That's right, and I think it's a great quote. And I called on our producer Pat to interject that because I needed to give credit where credit's due. Here's something I'm worried about: businesses.
No pun intended with your swimming pool analogy or Neil deGrasse Tyson's. But we know we have a fluid nature of the way society moves. We don't just stay in Salt Lake City all of the time. We share borders with other counties, cities. And I wish that the reality was that masks were going to be continuous and across these contiguous borders. But yes, we're doing the best that we can based on our data. And the important part, when I look at our local data, is that our hardest hit communities with COVID, basically throughout the entire pandemic, have been on the west side of Salt Lake City in our downtown area. Our data right now, based on the health department, shows us that only about a quarter of the residents in Glendale and Poplar Grove have had their first dose of the vaccine. When I look at the avenues and the East Bench, it's about 50% of the residents have had their first dose. We're just not there yet. And the county has targeted vaccination efforts in these communities that need it the most. They have the staffing capacity, and we understand that in the next few weeks, more and more doses are going to be coming out as production picks up. So we have the right plan. We're targeting in the areas we need to, but we need more time in order to make sure our residents are safe.
Why are the wealthier communities, you're saying, getting this more quickly than, say, the less wealthy communities?
Even when we think about it from a city standpoint, when we hold public hearings and they're at 7:00 at night, and that's when public hearings happen. And historically, you have to come to City Hall and stand in front of the council and be able to speak English and to be able to convey your point. That all of those limitations are barriers for participation. And I know that our partners at the county health department, as they look at how do we set up scheduling so that people who work a swing shift, who work a grave shift, who don't have childcare, who maybe work 2 or 3 jobs, can even fit the time to get vaccinated into their schedule. What do we do with neighborhoods that are part of our digital divide, who maybe don't have internet? They may not have access to a computer easily to get on and schedule their vaccine. These are all real limitations that the pandemic has highlighted and exacerbated in some circumstances. Time, outreach, education, and our investment in these communities is what's going to help us bridge the gap, but it's going to take longer.
What is an average guy like me supposed to think?
I hope that you'll make decisions not only based on yourself, but based on the well-being of the people and even the strangers around you that you encounter on a day-to-day basis. That's what makes America. That's what's made America who we are. Caring about one another, putting ourselves aside at times when the nation needs us to come together and unite. And this is exactly one of those times. And in my lifetime, I don't know that there's ever been quite a circumstance such as this, where the need for us to think beyond ourselves is so tangibly obvious as we look at the millions of people who've died from this pandemic.
Very well said, Mayor Mendenhall. You know, you were a hero, I think, to business in the city, because all of this controversy is going on, where a business requires someone to wear a mask, and somebody wants to come in and have an argument over whether or not masks cause too much carbon dioxide and all the other silly things. But when it was a city mandate, as it continues to be, I think you're the hero to business. Your thoughts?
Well, I know not all businesses agree with us, but many of them, the Downtown Alliance and Salt Lake Chamber, have stood with this decision. By and large, it is easier when it's not that business owner making the rules about wearing a mask, but it's a local government mandate, whether that's city, state, or county. So we were listening and working with our business community as we considered making this decision. But ultimately, we're all looking at the same data. We're looking at the fact that we're not there yet, and it's just not time yet to take these masks off.
One more thing. Does this make you crazy that we are in the public getting blasted from all different sides on this thing, and it's just a matter of science?
I got into this job, not only the work as mayor, but I got into politics because of science and because of, I think, the importance of government doing everything that it can as it works with the economic factors, the population growth factors, the science, and the real needs of a community: food, public safety, our international relations. My dad was exposed to a lot of DDT as a kid. Used to run through the fields when the airplanes would come and drop it like snow over a field. And he died too young of non-Hodgkin's lymphoma. And years later, I came to learn about this disproportionate impact on his generation in his county in Illinois from overexposure to DDT. It's shifted my whole mindset about what is government's responsibility and what is science's responsibility in making advances that help us to grow and maintain and sustain as a society while protecting our health. And that's where I wanted to work. That's what got me into air quality work. And that's why I wanted to work at the policy level here at the city.
You haven't talked me down off the ledge like I was hoping you would. But thank you very much for joining us, Mayor Erin Mendenhall of Salt Lake City.
Keep calm and carry on, Bill.
That is it for episode 19 of the Bill Gephardt Show. For the latest in breaking local news, go to GephardtDaily.com.